More testing and more COVID-19 cases. Tonight, we take a look at where those patients are coming from and what one hospital is doing to help. Where Stephanie Poole joins us in the studio with more. Stephanie.
That's right, Joey. The Mississippi State Department of Health reports Oktibbeha County has 243 coronavirus cases. Just in the last 2 weeks, nurses at OCH say a spike in positive tests has them working around the clock.
This virus is still very present. COVID-19 is still something that we are worried about. It is still something that we are seeing very ill people coming in with.
Savannah Brown is an infection control director at OCH Regional Medical Center in Starkville. She says while some people do test positive for the virus, they're noticing that the majority of patients are from long-term care facilities.
In our county right now, we do have several long-term care facilities that are dealing with COVID-19, one or two in particular where we are seeing a pretty significant outbreak. And while that outbreak does not the patients in that outbreak do not account for the entire spike, we do have quite a few employees at some local long-term care facilities that are also testing positive, and those people do count as part of our community count.
Due to those high numbers, the hospital is relying on extra hands to assist infected patients.
We have had to stretch our staffing a little bit. We have some OR staff that are helping on the COVID units as well as our med-surg units, both in our COVID ICU as well as our normal ICU. It has helped a good bit, I will be honest about that, because right now, partially due to this long-term care facility outbreak, we are seeing a lot of COVID-19 patients compared to what we had been seeing prior.
Those volumes are reflecting the amount of people testing too. ICU Medical Director Cameron Huxford says the amount of COVID-19 testing has almost doubled.
We did have an increase last week compared to prior weeks. We've been averaging about 40-something in the drive-through for the last few weeks. That went up to mid-60s. Many of those were people who had been exposed to someone who had been told they had the virus, so it was like, contact tracing.
Huxford says while it seems like COVID-19 numbers are going up, more patients with the virus are actually recovering.
I don't want to minimize the fact that we say we only have long-term care facility patients here. We are able to take care of other folks with the coronavirus. It's just the average healthy person in the community is not needing hospitalization.
All of OCH's outpatient clinics are now open. Visitors must go through mandatory screening before they can enter the hospital.